A recent report has shed light on some concerning practices within Edinburgh's psychiatric ward for young people, sparking a much-needed conversation about patient care. The use of physical restraint and forced tube feeding has raised eyebrows, leaving many questioning the well-being of these vulnerable individuals. This report, which focused on the Melville unit at the Royal Hospital for Children and Young People, is part of a series of inspections ordered by ministers. The impetus for these inspections was a BBC Scotland disclosure programme that uncovered allegations of a culture of cruelty at another facility, Sky House in Glasgow. While NHS Lothian has assured that a robust action plan is in place to address these concerns, the inspection, conducted jointly by the Healthcare Watchdog and the Mental Welfare Commission, MWC, revealed some areas for improvement. The MWC, which previously visited such units but did not consider them official inspections, will now collaborate with Healthcare Improvement Scotland, HIS, to conduct these inspections. Both organisations found high staffing levels and examples of good practice at the Melville unit, but also identified the safe use of proportionate restraint as a significant issue. Restraint was often employed for nasogastric feeding, a procedure where a feeding tube is inserted through the nose into the stomach. Claire Lamza, Executive Director of Nursing at MWC, acknowledged the necessity of restraint in certain situations but emphasized that it should be a last resort, used as infrequently as possible. During an unannounced visit to the 12-bed facility, inspectors observed 8 staff members restraining one young person. They criticized the poor documentation of these incidents, with one case record detailing a 2.5-hour restraint involving 6 staff members. The report warned of the potential risks and consequences, citing instances of bruising and trauma experienced by patients and their relatives. Grace Vickers, a former patient at the Melville unit, shared her traumatic experiences, including being restrained for forced tube feeding. She described the lasting impact of these incidents, which she believes led to her developing complex post-traumatic stress disorder. The inspection report acknowledged some improvements since Grace's time at the unit, but it also highlighted a concerning number of restraint incidents over a 2-year period. Out of 661 reported incidents, 533 involved the use of restraint. Inspectors were also troubled by a whistleblowing report alleging the overuse of restraint at the facility in 2023. The layout of the unit was also criticized for being too small, potentially exposing other patients to incidents of aggression and violence. The joint report stated that the unit had failed to implement previous recommendations by the MWC, indicating a lack of managerial oversight and action. Despite these concerns, the report also praised the commitment and training of the staff at the Melville unit. Young people in the facility reported feeling listened to by staff regarding their care and treatment. NHS Lothian has stated that it takes these findings extremely seriously and is committed to delivering safe, high-quality care. Jim Crombie, the Health Board's Deputy Chief Executive, emphasized that restraint is only used as a last resort to prevent harm to young people, staff, or other patients. He added that an initiative to further reduce the use of restraint has shown positive results. We continue to prioritize this work by training and educating staff in safe restraint techniques, care planning, managing distress, and responding to violence and aggression, Mr. Crombie said. Our goal is to support these young people in their future care, including those who require essential nasogastric tube feeding. This report serves as a reminder of the delicate balance between ensuring patient safety and providing compassionate care. It invites us to consider the complexities of psychiatric care for young people and the need for continuous improvement and oversight. And this is the part most people miss: it's not just about the physical restraint, but also the emotional impact and long-term consequences for these young individuals. What are your thoughts on this sensitive issue? Feel free to share your opinions and experiences in the comments below.